Dave here with Synergy Wellness in New York City. And today we're going to demonstrate on Sylvia here myofascial release. We're going to do a couple of different techniques, a mixture of ART, myofascial release, which is releasing a tight muscle or a tense muscle or a muscle spasm. We're going to show you how we do that through a couple of different methods. And we have a table here that helps a lot and does tilting and moves for us and makes things a lot easier. So we're going to release her all the muscles across her shoulders, the supraspinatus, infraspinatus, and the trapezius muscles. And this could be uncomfortable, but it's sort of like a good pain, right? For lack of better words, it's you know, if you've ever had trigger points across your shoulders, or if you get tension headaches, or neck pain, or pain shooting down the arm, this is really great. A really great myofascial or muscle release technique. And again, it can be very sore for some people. She's much better. The first 2 visits, she was really sore. She's doing much better. How you doing there? Good. And the other side may actually be worse for you, right? Yeah. So this is actually her good side. And this is really also helpful for the desk worker. And in New York City, just about everybody works in front of a desk. If you're not working in front of a desk, you're probably on a tablet, laptop at home with bad ergonomics, or on your cell phone, your smartphone with your head down. Something important to note that for every inch forward that your head is, that adds 10 pounds of weight to your head. So what that means is these muscles back here have to work in overdrive to hold the head up, or they're having to hold just heavier weights than what they're built for. Most people, when they go to the gym, they're not working out their traps and the back of the rotator cuff muscles as well as they are other parts of the body. And usually there's an imbalance just because everything we're doing is in front of us. So we're typically stronger in the front flexors than we are in the back where the extensors are. And that's the case for her. She's a chef. Everything is down and in front of her. All her work is. Now we're going to go to the other side. How's this? A little bit more sensitive, tighter. Yeah. This table's nice. It's able to rotate really easily, and we're able to do it with the lower half the table as well, and it makes doing active release technique easier. And then we even have the patient tilt her head. So now I'm going to have you move your head to this side, this, and then you're going to go back, yep, and then you're going to move it back this way, good, and back, good, and then back to the left, good, to the right, and to the left. Just helping her along a little bit, and now you can relax. Any headaches at all in the last few days?
Very little.
Okay. So she's still getting headaches. That's something really easy for chiropractors to help. If you look at all the latest research, there's plenty of research showing the efficacy of chiropractic in management of cervicogenic headaches, meaning headaches that come from tension in the neck, which are probably about 90% of headaches. How's that? Still sensitive there? So, after we finish up with a little bit of myofascial release and active release technique. We then have this machine, and this is called a PTLMS. It stands for Professional Tendon, Ligament, and Muscle Stimulator, and that's exactly what it does. But it actually doesn't stimulate it, it relaxes the muscle spindles using vibration. So we're going to run that across her shoulders here and loosen the shoulders up even more. And she's going to be feeling like Gumby when she walks out of here. Maybe that Gumby reference is for us older folks like myself. Probably a lot of you don't know who Gumby is. Gumby is the most flexible cartoon character beside Plastic Man. So we're just going to run this across our trapezius muscles. And along the rotator cuff muscles. How does that feel?
A little painful, but very good.
Kind of like the soreness that we had up here when we did the release, the myofascial release and the trigger point therapy.
Yeah, afterwards you relax.
Yeah, so it's very common for the muscles to be sore in the beginning of treatment, but after you get medical massage for 6, 7, 8, 9, 10 visits, you will see a big difference. The muscles are not as sore, they're much more relaxed, they're softer, and the range of motion is improved greatly. So we're going to keep going and using it along the rotator cuff muscles on both sides and along the traps and shoulders. But that gives you a good idea of what we do when it comes to medical massage and how it can help. We do it in different parts of the body, the lower back and the glute region, the hip flexors. It just depends on where your injury is, or the IT band if you have IT band syndrome and you're a runner. We even use this machine on the bottom of the feet if you have plantar fasciitis. So if you have any questions about medical massage, ART, trigger point therapy, just feel free to comment below, and thanks for joining us.